And how did the tests behave for differentiating patients with poor outcome or with good outcome? As you can see, CACTA really didn't help, neither of the three samples. Beta-D-glucan was positive very frequently and could not differentiate these two cohorts of patients either, while the first sample of the T2 MRI could help us very well to differentiate these populations. Here you have the yield of the three tests for identifying patients with poor outcome. And as you can see, the first sample for T2 was really very hopeful for this purpose. What about early mortality? Could this test help us to differentiate patients who were at risk of dying within 7 days? Okay, again, the T2 was able to help us with that, and this was a very interesting finding for us, if this is confirmed when we finish this interim analysis and this study. For in-hospital mortality of any course, again, the T2 was the only test that could help us to differentiate patients who were about to die or not under the suspicion of invasive candidiasis. So, our conclusion of this second study is that in patients receiving empirical antifungal treatment because you are suspecting invasive candidiasis, a positive T2 MRI is associated to a high risk of poor outcome, defined as either diagnosis of invasive candidiasis or early mortality.